we're talking about infant mortality rates for African American women that rival some third world countries.
We launched our diabetic outreach program because in all clinics there are no patient group that serve the Chinese or the Asian community due to the language barrier.
I don't think that Oregon can call itself a progressive state if you have the level of inequities that have been highlighted both by the Urban League State of Black Oregon report and other reports like the Communities of Color Unsettling Profile.
Health equity advocacy, the way that it was designed this last session, was really meant to empower people and bring new people into the fold.
My knees were knocking because I was just a little nervous.
It was a hearing for our main health equity bill.
And it was so wonderful to see such a large group of people who represented so many different backgrounds.
And that hasn't really been seen before from communities of color, especially Latino, Asian, American communities, immigrants and refugees, and African Americans.
We have amazing people of color, immigrant refugee leaders, who are actually recognizing that we are in this together.
It really felt powerful. It felt like a united force.
Real transformation happens when voices are united.
We were really hoping that Oregon would get on the bandwagon with other states, such as New York, who have had cultural competency in place for a number of years.
This cultural specific approach actually make people feel like home. When we provide services, we match our staff who are coming from the same homeland or sharing the same culture and speak the same language. I hope from the state legislators level to recognize the contributions of cultural specific provider so that we become a strong ingredient to make the transformation a success.
I've done my research. I know how the system works. I know the laws of the land, so I deserve to be there just as much as anyone else.
We are building institutions that can continuously work on these issues in the long haul.
It's not the last time we're going to have this conversation.